students, we are continuing with the hepatitis viruses. We have seen hepatitis B virus, that is a very important topic. So we also should know what are the other hepatitis viruses and what are the conditions they cause, like how they are transmitted and what are the complications they cause. So this classification we have already seen in the first class of hepatitis. So once more you can have a revision on the types of hepatitis viruses, and the only double-stranded DNA virus is hepatitis B, which we have finished, and the others are the single-stranded RNA. And I'll tell you the modes of transmission of hepatitis B you have already seen. It is like parenteral, perinatal, and percutaneous, and sexual route of transmission. The same route of transmission is there for hepatitis C and hepatitis D. So these three are transmitted in similar way. Whereas hepatitis A and hepatitis E are transmitted through fecal-oral route. So the viruses which are hepatitis viruses which are transmitted by fecal-oral route are hepatitis A and hepatitis E. So the others are by common modes of transmission like through blood and body fluids, through sexual route and all. But A and E are transmitted by food and water. So coming to hepatitis A virus, it is actually a non-enveloped virus. So this doesn't have an envelope. It is a non-enveloped virus because this belongs to the Picornaviridae family. All the members of Picornaviridae lack envelope. They are just a 27 nanometer nucleocapsid particle with a capsid protein and a single-stranded RNA. So it is having a icosahedral symmetry. The hepatitis caused by this A virus, you call it as infectious hepatitis. Generally, this can cause outbreaks in places where people consume the same kind of water or food which is contaminated with this virus. Mostly, we'll hear about the foodborne and waterborne outbreaks of hepatitis in hostels or in other places, which is commonly caused by hepatitis A virus. And you call it as infectious hepatitis because it causes outbreaks, and they are usually subacute disease, like it's not acute or chronic, it's like a subacute disease, and it mainly occur in children and young adults. Hepatitis A virus enters the body by the oral route. I told you it's fecal-oral route because this virus is excreted in the feces and it can contaminate food and water, and it enters by the oral route. There are two stages for hepatitis A, like how we have seen for hepatitis B. We had a pre-icteric phase, an icteric phase, and a convalescent phase. Similarly, this one also has got a prodromal or a pre-icteric phase and also an icteric stage. So what will be the symptoms in the prodromal stage? It will be fever, malaise, that is fatigue, anorexia, nausea, vomiting, and at times they will have liver tenderness. Okay, right hypochondrial pain. And when jaundice sets in, you call it as an icteric stage. And recovery usually occurs in 4 to 6 weeks. Hepatitis A virus disease is not that much problematic. It will usually recover in 4 to 6 weeks. You just have to give a symptomatic and supportive treatment. How will you diagnose this? You can have a demonstration of the virus, or you can detect antibody, and you can perform the liver function test. Also, we can do a molecular test like PCR. For what PCR? It is RT-PCR for the viral RNA. So this can be done from the feces sample because the virus is excreted in the feces. So demonstration of viral antigens, demonstration of virus can be done by demonstration of viral antigens in the sample by immunoelectron microscopy. Also, you can perform an ELISA test in the fecal sample to detect the viral antigens. So isolation of hepatitis A virus is quite difficult. So what you can do is you can directly visualize the presence of virus in the sample feces by using immunoelectron microscopy, or you can, why you use immunoelectron microscopy? To make it more specific, you're adding the antibodies so you can visualize it better. Or you can do an ELISA test to detect the antigen from the fecal sample. Now, what is the mainstay of diagnosis is actually ELISA, which you do for detection of the antibodies specific for HIV. Anti-HIV antibodies in serum is detected by ELISA test. Liver function tests like ALT, alanine aminotransferase, bilirubin will be high in case of infectious hepatitis. So that is about hepatitis A virus. And how will you treat hepatitis A virus? You can treat by just giving them a supportive and symptomatic treatment. That is fine. So you should remember A is similar. A and E causes similar presentation. Both of them are transmitted by fecal-oral route. They will cause similar presentation, like it will be occurring as outbreaks transmitted through food or water. And diagnosis is also similar. You can either go for detection of antibody in serum by ELISA, or you can detect the presence of viral antigen in fecal sample either by an immune electron microscopy or an ELISA test, or you can go for a PCR test for detection of the viral RNA. Coming to the next virus, that is hepatitis C virus, this belongs to the family Flaviviridae, and this is a little more bigger, 150 nanometers in size. It has got a single-stranded RNA. And the modes of infection of hepatitis C is very much similar to hepatitis B virus. So it's very much similar to hepatitis B virus, like it is parenteral route, percutaneous route, perinatal transmission, and sexual transmission. Hepatitis C virus require a little more volume of blood to transmit the disease as compared to hepatitis B. Hepatitis B, we have discussed that it is 30% chance if you have a percutaneous exposure with positive blood, but in case of HCV, it is 3% chance. It requires a more volume of blood for transmitting the disease, so it is mostly associated with transfusion-related hepatitis. So the same modes of transmission, parenteral, that can be through blood transfusion, percutaneous, needle stick injury or IV drug abusers, perinatal from mother to child, or sexual transmission. Clinical picture is almost the same as hepatitis B. The reason is immune-mediated destruction of hepatocytes, and it can lead to a pre-ectric stage, ectric stage, and convalescent phase can be present here also. And the problem with hepatitis C, this is more of a chronic hepatitis type. This is more prone to cause chronic hepatitis. So if you get an infection with hepatitis C, it's almost sure that you have the chance for developing chronic hepatitis, cirrhosis, and hepatocellular carcinoma. So chronic hepatitis will progress to cirrhosis, and later on, these patients can develop hepatocellular carcinoma at a later point in their life. So how we will detect hepatitis C virus? You can detect the presence of antibodies. So most of the viruses, the mainstay of diagnosis is detection of viral antigen or viral antibodies, either in serum or directly from the sample. You can detect viral antigen. Antibodies are detected in serum, and you go for a molecular test for a better test, that is better sensitive, better specific test is a molecular test. So here also we have an anti-HCV antibody detection kits are available. We can do it by ELISA test, or you can pick the HCV RNA by a PCR test. And only general prophylaxis is possible. There is no vaccine available for hepatitis C. So HCV antibody screening is performed along with hepatitis B antibody screening, antigen screening for before blood transfusion, before organ transplantation. Similarly, before any kind of surgical procedures, we regularly do screening for 3 bloodborne viruses, that is HIV, hepatitis B, and hepatitis C. These 3 viruses should be screened in the blood of a patient before you are subjecting them to any kind of procedures, because if they are positive, you have to take all the precautions and you have to prevent the transmission. So similarly, antibody testing for HCV, hepatitis B, and HIV is always done before blood transfusion and before organ transplantation. So treatment of hepatitis C, you have this, mostly it is supportive treatment, but we have tried interferon alpha and also ribavirin is a drug. These 2 drugs are tried for treatment of hepatitis C, and we have found cases which have completely recovered from the virus by treating with these 2 drugs. So there is a chance of hope for treatment and complete cure from hepatitis C, but still the risk of chronicity is very high. That is why we are more concerned about hepatitis C. And coming to hepatitis B virus, this virus is actually doesn't have any existence of its own. It is just a circular DNA. It's like a circular DNA, a single-stranded DNA, and 36 nanometers in size. And this belongs to the genus Delta virus. You call that antigen as Delta antigen. And this virus is called as an incomplete virus. Why? Because it cannot cause infection by itself. It requires the HBs antigen envelope to surround this genome. It requires this HBs antigen to surround this genome. Only then this can cause infection. So this is the delta antigen. You can see the delta antigen, and this is the HBs antigen envelope, that is, it needs the surface envelope of hepatitis B virus in order to cause infection. So it can cause infection only with hepatitis B virus. It can either be a co-infection or can be a super infection. So already people who are infected with hepatitis B can get a super infection with hepatitis D, or both of them can infect together. That is how hepatitis B acts. So laboratory diagnosis of hepatitis D is by exclusion of hepatitis A and hepatitis B, first of all, and you can check for anti-hepatitis D antibody by ELISA. You can also look for the virus by immunoelectron microscopy, and also you can pick viral RNA by PCR. So this is also an RNA virus. Remember, D is called the delta antigen, and it's not a complete virus. It requires the hepatitis B envelope to cause an infection. So coming to a summary of the hepatitis viruses, we have 5 types of viruses. You know the family, you know the nucleic acid, and you have to remember the mode of transmission. Which are the viruses that have an enteric mode of transmission? A and E. A and E causes infection by enteric route, or it is through food and water, or fecal-oral route. And what about the other three? They have similar modes of transmission: parenteral, perinatal, and sexual mode. And incubation period, you can see A and E are having similar incubation period. But for B, it is longer, and C also it is longer. It can be go up to 150 days for hepatitis B and C. And D is also having a comparatively shorter incubation period compared to B and C. And what about the risk of chronic hepatitis? There is no risk of chronic hepatitis in hepatitis A and E. They are just acute hepatitis or subacute hepatitis, which recovers by themselves. Whereas for B, C, and D, there is risk of chronic hepatitis, which is most higher for hepatitis C. C has got the highest risk for chronic infection, chronic hepatitis, leading to cirrhosis, and later on it can lead to hepatocellular carcinoma. So if you get a question on name two oncogenic viruses, viruses which causes cancer, you can definitely remember hepatitis B and hepatitis C. Also, you can add to the list Epstein-Barr virus and human papilloma virus. So these are the examples of oncogenic viruses, viruses which causes cancer. So treatment is symptomatic treatment for A and E, whereas you can give the drugs like interferon alpha, tenofovir, and lamivudine for hepatitis B. You can give interferon alpha and ribavirin for hepatitis C. You can give interferon alpha for hepatitis D. So this is the treatment of hepatitis viruses. So mostly, most of the cases it is a symptomatic and supportive treatment, but we have certain drugs available to try for hepatitis B, C, and D. So that is about the hepatitis viruses, and this questions you can once more go through the questions, previous year questions, which are asked from this section. Hepatitis C and hepatitis A can also be asked as 2-mark questions. So that is about the hepatitis viruses. Thank you.